Welcome. Today, we're diving into the world of peri-implantitis, a condition that affects dental implants and can have serious consequences if not managed properly. Peri-implantitis is essentially a progressive loss of bone around an implant, accompanied by inflammation of the surrounding soft tissues. It typically starts at the top, or coronal portion, of the implant, while the lower, or apical part, remains firmly attached to the bone. Importantly, the implant usually stays stable until the disease has advanced significantly. Understanding peri-implantitis is crucial for both dental professionals and patients with implants, as early detection and management can make a big difference in outcomes. Peri-implantitis is defined as a progressive loss of bone around a dental implant, coupled with inflammation in the soft tissues nearby. This means that not only is the bone that supports the implant being destroyed, but the gums and other soft tissues are also reacting with redness, swelling, and sometimes pain. The process begins at the uppermost part of the implant and, as it progresses, can threaten the stability of the entire implant. However, in the early stages, the deeper part of the implant remains integrated with the bone, and the implant itself doesn't feel loose until much later. The disease process of peri-implantitis starts at the coronal, or upper, portion of the dental implant. This is the area closest to the gum line and is most exposed to bacteria and other irritants. As the condition progresses, the bone loss moves downward, but the lower part of the implant often remains attached to the bone for some time. This unique pattern of bone loss is a key feature of peri-implantitis and helps differentiate it from other implant complications. One important clinical sign of peri-implantitis is implant mobility. However, it's important to note that the implant usually remains stable until the disease is quite advanced. In the early and moderate stages, the implant is still firmly anchored in the bone, and mobility is not detected. Only when a significant amount of bone has been lost does the implant become loose, which is a sign of late-stage disease and often indicates a poor prognosis. Clinically, peri-implantitis often presents with noticeable changes in the color of the gum tissue around the implant. The healthy pink color may turn red or bluish, indicating inflammation. These color changes are often one of the first visible signs that something is wrong. Dentists look for these subtle shifts during routine checkups, as early detection can help prevent further damage. Another hallmark of peri-implantitis is bleeding when the gums are gently probed. This bleeding is a sign of inflammation and is similar to what is seen in gum disease around natural teeth. Dentists use a special probe to gently check the depth of the pocket around the implant, and any bleeding is a red flag for underlying disease. As peri-implantitis progresses, pockets form between the gum and the implant. These pockets are spaces where bacteria can accumulate, making the condition worse. Dentists measure these pockets during exams, and deeper pockets are associated with more severe disease. Radiographs often reveal bone destruction in these areas, confirming the diagnosis. Suppuration, or pus formation, is another sign of peri-implantitis. This is often accompanied by swelling of the gums and the presence of calculus, or hardened plaque, around the implant. These signs indicate an active infection and require prompt attention to prevent further bone loss and implant failure. Mobility is used to detect both early and late failures of dental implants. While early mobility is rare, its presence can signal a problem with the initial integration of the implant. Late mobility, on the other hand, is usually a sign of advanced peri-implantitis and significant bone loss. Regular monitoring for mobility is an important part of implant maintenance. Diagnosing peri-implantitis involves using many of the same clinical parameters as those used for periodontal disease around natural teeth. Dentists evaluate oral hygiene, the health of the tissues around the implant, and the interface between the bone and the implant. These assessments help determine the presence and severity of peri-implantitis and guide treatment decisions. Probing around implants is a key diagnostic tool. In healthy implants, the probe can usually penetrate about 3 to 4 millimeters. The bone level is typically about 1 millimeter below the tip of the probe. Monitoring changes in probing depth and clinical attachment over time is essential for early detection of peri-implantitis. Radiographs, especially periapical intraoral X-rays, are invaluable for assessing the bone around dental implants. These images allow dentists to see the extent of bone loss that may not be visible during a clinical exam. Regular radiographic monitoring helps track changes over time and can reveal early signs of peri-implantitis before symptoms become severe. Monitoring the microbial environment around implants is another useful diagnostic tool. By evaluating the types and quantities of bacteria present, dentists can assess the health of the tissues and the risk of disease progression. This information can also help tailor treatment strategies to the individual patient. Implant failures can occur either early, soon after the implant is placed, or later, after the restoration is completed. Early failures are often due to issues like improper site preparation, bacterial contamination, poor mechanical stability, or loading the implant too soon. Late failures are usually the result of excessive force on the implant or infections such as peri-implant mucositis and peri-implantitis. Early implant failures are most often caused by problems during the initial placement of the implant. These include improper preparation of the site, contamination by bacteria, inadequate mechanical stability, or loading the implant before it has fully integrated with the bone. Addressing these factors is crucial for long-term implant success. Late implant failures typically result from excessive forces on the implant or from infections. Peri-implant mucositis, a reversible inflammation of the soft tissues, can progress to peri-implantitis if not managed. Both conditions can compromise the stability of the implant and ultimately lead to failure if not addressed promptly. Managing peri-implantitis often involves occlusal therapy, which means analyzing how the teeth fit together and adjusting the bite to reduce excessive forces on the implant. Proper occlusal equilibration can help prevent further bone loss and improve the longevity of the implant. Anti-infective therapy is a cornerstone of peri-implantitis management. This includes local plaque removal using plastic instruments or pumice, subgingival irrigation with chlorhexidine, and sometimes systemic antimicrobials for about 10 days. It's important to note that conventional steel or ultrasonic instruments are not suitable for cleaning implants, as they can damage the surface. Soft lasers are also being explored as a promising adjunct. When non-surgical methods are not enough, surgical techniques may be used to try to reintegrate the implant with the bone. These procedures are often adapted from those used to treat bone defects around natural teeth. The goal is to restore lost bone and create a healthier environment for the implant. Ongoing maintenance is essential for patients with dental implants. Regular recall visits every 3 months allow for close monitoring of the implant and early detection of any problems. Cumulative, interceptive supportive therapy is a proactive approach that helps catch infections early and maintain implant health. Proper oral hygiene is critical for preventing peri-implantitis. Patients should use soft, rounded bristle toothbrushes, minimally abrasive toothpaste, and chlorhexidine rinses as recommended. Interproximal cleaning with gauze, superfloss, or irrigators is also important to keep the areas around the implant clean and free of debris.